A very good morning to everybody. First of all, I would like to congratulate the Policy Times for this initiative of organizing the India Healthcare Summit 2022, which is bringing together healthcare professionals across the country and world together, along with health policymakers, to deliberate on various issues related to healthcare. Priyanka Das from Madhya Pradesh, would like to state what my state is specifically doing, what are the government objectives or what is the government perspective on the healthcare. National Health Mission, as you know, looks after the entire programmatic requirements of the state when it comes to assuring quality healthcare to all. Today we are talking about universal health coverage, which means affordable, accessible healthcare to everybody near the doorstep. For this, Government of India has launched, a very ambitious program wherein Ayushman Bharat Health and Wellness Centers are being set up across the rural landscape of the country. I am happy to announce that in the state of Madhya Pradesh, we've been able to operationalize more than 10,000 health and wellness centers where new people in the form of community health officers have been posted, and they are to offer an expanded range of 12 services, which include not just maternal and child health care, but also relate to communicable, non-communicable diseases, palliative care, ENT packages, oral health packages, emergency services. So now we actually have a very robust system of ensuring access and quality healthcare to the people of the state. Coming on to the topic of today's deliberation, Madhya Pradesh has taken quite a few initiatives wherein the private expertise has been clubbed with the public needs, and we have several projects of public-private partnership running in the healthcare system in the state of Madhya Pradesh. If you're aware about the state is quite diverse. It actually encompasses more than 8.5 crore population. We have a very diverse topography, and regional cultural mix also varies from region to region. We have almost 20 tribal districts and 89 tribal blocks. Some of them are in deep forest and hard to reach areas. So definitely there is the challenge of ensuring affordable healthcare to all in every corner of the state. What the state decided was, wherever we have these gaps in terms of technology infusion or in terms of capital infusion, we have gone in for a PPP model. We have PPP model running for several of our diagnostic services. At the district hospital level, we have a wet lease model for laboratory services, wherein the private vendor has actually installed high-end diagnostic machines, and all kinds of more than 130 kinds of diagnostics tests are available. All the tests are available free of cost to the citizen. Per cost test is charged to the government, and the vendor was selected through a very transparent bidding process, and there was actually a discount on the CGHS rates, and I'm happy to announce that we have had substantial savings. Now, through this PPP model, what we have ensured is that we have ensured service delivery. Earlier, when it was being run only by government, we had challenges of personnel, we had challenges of optimal level of utilization of resources, we had challenges of consumable availability. Now, once this is done in a PPP model, it is our pathologists and our lab technicians who are trained on the new machines. They run the tests. We have a very robust laboratory management information system, and just like any other big private laboratory provides its diagnostic services and its reports on, mobiles and through WhatsApp link. These facilities are also available. So we've had, technology infusion, software infusion through the private vendor. We've provided space in the government setup, and we've ensured that none of our doctors refer patients outside for their diagnostic tests now, when that it is available in-house through a PPP mode. So this way we are ensuring that the people do not have to spend their own money for diagnostics, because if you have read the recent studies, one of the major costs of out-of-pocket expenditure is on the diagnostics, because the consultation was always free in the government setup and the drug or the medicine was always available in the government setup. What was lacking was this diagnostic part. After seeing encouraging results in the laboratory services at the district level, we have rolled it out even at the block level now, wherein we have a hub and spoke model of providing laboratory services. We have our hubs established in PHCs, where again we have 3 kinds of machines installed, and spokes are all our sub-health centers, all our health and wellness centers through which samples are collected. So now the same facility which is available in the district hospital, we are trying to replicate it at the block level, thereby trying to reduce the travel cost and time and resource of the people for smaller kinds of investigations and pathological tests. Now rural people do not have to travel 50 kilometers, 60 kilometers and line up in our DH for these kind of diagnostics. On similar model, we have the CT diagnostics, which is there in every district hospital. We have 52 district hospitals in Madhya Pradesh. Everywhere we have 32 slice high-end CT diagnostic machines. This is also done on a PPP model. Madhya Pradesh is also lacking in terms of specialist doctors. Though we are now recently opening up a lot of medical colleges, and but to get those doctors, we still have 3 to 4 years time. In the meanwhile, we are grappling with almost 60 to 70% shortage of specialist cadre. To tackle this problem, we also have looked at telemedicine and teleconsultation sort of possibilities. We again have a PPP model running, wherein teleconsultation is done through our PPP vendor. The spokes are located in our PHC, so where we just have an MBBS doctor and we do not have a specialist, say a gynecologist or a pediatrician or an MD medicine, and cases which cannot be tackled by the medical officer, those cases are referred as doctor to doctor teleconsultation. The hubs are located outside Madhya Pradesh in Jaipur and Kolkata, so the specialist doctors from there provide teleconsultation. But we have framed our tender and policy in such a manner that the drugs that are prescribed by the vendor is a part of our essential drug list. So whatever is part of the essential drug list, only that is prescribed by our doctors. So effectively, a patient who is walking into a PHC can get specialist teleconsultation and medicine at the same time once the consultation is done. This is also running quite successfully. We've had more than 7 lakh specialist teleconsultations in the previous year. So these are some of the PPP initiatives that Madhya Pradesh has taken up, and we are having very encouraging results. And I foresee that in the future, health sector will open up many more such possibilities where we can infuse expertise as well as skills from the private sector, and a healthy win-win partnership for all, wherein citizen is at the core of the services and the partnership. The citizen should be served with best quality healthcare at free of cost, because that is what the objective is, and it should be a win-win partnership for both the government as well as for the private vendor, so that there is a healthy balance, and there also has to be a proper check and balance in any kind of PPP that we do. And I'm very hopeful that such good models will be discussed throughout the course of deliberation, and I wish everyone all the best for all their future endeavors, and happy consultation and happy deliberation to all. Thank you.